Colon cancer screening. Colorectal cancer is a term for cancer of the large intestine or rectum. The primary goal of colorectal cancer screening is to prevent deaths from colorectal cancer. Screening tests can help identify cancers at an earlier and potentially curable stage. Screening can also prevent cancer by identifying and treating precancerous abnormal growths that can be removed before they become malignant or cancerous. Adults should undergo colorectal cancer screening beginning at the age 45 or earlier, depending upon the risks of developing colorectal cancer. Several tests are available, each of which has advantages and disadvantages. The optimal screening test depends on your preferences and your risk of developing colorectal cancer. Why does colorectal cancer screening work? Most colorectal cancers develop from precancerous polyps. Polyps are growths that form in the lining of the colon. They can be detected with the colonoscopy, a CT colonography, and to a lesser extent by other tests such as stool test for colorectal cancer. The two most commonly detected types of polyps are adenomatous and hyperplastic. Adenomatous polyps, also called adenomas, can become cancerous over time. This progression usually takes around 10 years in most people. Colorectal cancer screening tests can detect polyps in cancers. If a polyp is found, it is removed to try to prevent it from becoming more serious. Regular screening and removal of polyps reduces your risk of developing colorectal cancer. Similarly, if a cancer is found, it may be treated, hopefully at an earlier stage than it would have been found otherwise. Early detection of cancers that are already present in the colon increases the chance of successful treatment and decreases the chance of dying as a result of cancer. Who gets colon cancer? Personal or family history of colorectal cancer or polyps. People who have previously had colorectal cancer have an increased risk of developing new colorectal cancers. People who have had adenomatous polyps before the age of 60 years are also at an increased risk of developing colorectal cancer. Having a first-degree relative, such as a parent, brother, sister, or child, with colorectal cancer increases your risk of developing colorectal cancer. In addition, having a relative who had an adenomatous polyp is believed to increase your risk. Your risk may be further increased depending on how many family members are affected and the age at which their cancer or polyps were detected. There are some other lifestyle risk factors that increase your risk as well. These seem to increase a person's risk of developing colorectal cancer, and these include a diet high in fat and red or processed meat, and low in fiber, a sedentary lifestyle, cigarette smoking, alcohol use, obesity. Now, modifying these risk factors may help lower your risk of colorectal cancer, in addition to improving your overall health. However, the presence of these risk factors does not generally impact expert recommendations for when to begin colorectal cancer screening. What tests are used for colorectal cancer screening? Now, there are several tests available for colorectal cancer screening, which can detect precancerous polyps, such as adenomas, and can lead to cancer prevention and or detect cancers at an early, more treatable stage. Colonoscopy is the most sensitive of the available tests. It detects most small polyps and almost all large polyps and cancers, and substantially lowers the risk of developing and dying from colorectal cancer. On the other hand, CT colonography is another way which allows us to visualize the colon with an imaging-based examination. This is sometimes called a virtual colonoscopy. This is a CT scan to detect images of the entire colon. These images are 2- and 3-dimensional and are reconstructed to allow a radiologist to determine if polyps or cancers are present. The major advantages of a CT colonography are that it does not require sedation, it is non-invasive, and the entire bowel can be examined, and abnormal areas, adenomas, can be detected about just as well as a traditional optical colonoscopy. The disadvantages, though, however, there are some disadvantages like traditional colonoscopy. CT colonography usually requires a full bowel prep to clean out the colon. If an abnormal area is found during a CT colonography, a traditional colonoscopy will be needed to see the area and take a tissue sample. CT colonography may detect abnormalities other than polyps or cancer in the colon and rectum. Many of these incidental findings will require further testing that could lead to harm. CT colonoscopy, like many other imaging tests, exposes patients to radiation, which may have long-term risks. Stool tests can detect blood or abnormal DNA markers. Colorectal cancer often release microscopic amounts of blood and abnormal DNA into the stool. Although these tests involve collecting stool samples at home, they still do require a prescription from a doctor. Two types of tests, fecal occult blood testing was one, also called a guaiac test or FOBT, and fecal immunochemistry testing, FIT, evaluate the stool for blood, which may be present if there's bleeding from a colorectal cancer or other source. In addition, some polyps may also come back positive. FOBT, you collect 2 samples from 3 consecutive bowel movements, which you apply to home collection cards. You mail the cards back according to the instructions. You should avoid drugs that irritate the stomach, such as aspirin and NSAIDs, when preparing for the FOBT test before collecting the stool. FIT, you use the long-handled tool to collect the specimen according to the manufacturer's instructions. You then mail the kit back according to these same instructions. You do not need to change your diet or stop any medications with the FIT test. FIT is more convenient and somewhat better able to find cancer than FOBT, but the test kit is a bit more expensive. If a stool test is positive, your entire colon should be examined with a colonoscopy. Stool testing reduces the risk of dying from colorectal cancer. However, because polyps seldom bleed, stool testing for blood is less likely than other screening tests to detect polyps. In addition, false positives are common, which means that many people with a positive stool test will turn out to have colorectal cancer.